Just wanted to ask you before we get started, if there's anybody in the room with you, could you just make note in the questions box so you can kind of see who is all with us today. Once again, if you could just in the questions box, if there's anybody in the room with you today, just let me know so we can kind of see how many people are able to join us live. We are going to get started here. All right, so hi everyone, my name is Megan. I'm a health coach at Intera Health, and Snack Bite sessions are offered monthly on the fourth Thursday of each month around this lunchtime. During these sessions, you'll have an opportunity to learn more about specific health and wellness related topics. And as we all have limiting schedules and tight time frames, these snack bites are really intended to provide just a small bite of information for you. So today's topic is explore hydration and sun safety, and we'll talk more about the importance of hydration, and especially in the hot summer sun, how to hydrate, the symptoms of dehydration and how to avoid it, and also the impact the sun has on us with hydration. All right, so a good question is, how much water should we be drinking each day? Pretty simple, right? But there's really no easy answers. Studies have produced various recommendations over the years, but in truth, your water needs depends on how many different factors, including your health, how active you are, and really where you live and the climate you live in. Although no single formula fits everyone, knowing more about your body's needs for fluid will help you estimate how much water to drink each day. So how much fluid does the average healthy adult in a temperate climate need? The Institute of Medicine determines that an adequate intake for men is roughly about 13 cups, which is about 3 liters of total beverages a day, and the adequate intake for women is about 9 cups, which equates to about 2.2 liters of water or beverages each day. The body requires water to function properly, and the body is made up of approximately 60% water. Every cell, every tissue, every organ in the body requires water to work properly. Water also helps to regulate body temperature. The body can become overheated, especially when exercising or if you're out in extreme heat. When the body is overheated, it causes a strain on the cardiovascular system. Water also helps remove waste. If it's not able to remove that waste, toxins build up and can cause damage to your cells. Water also helps to lubricate joints. Joints become stiffer and less mobile and decrease range of motion without proper hydration. Factors that influence water needs that go beyond the initial adequate intake are exercise. So if you're exercising, an extra 1.5 to 2.5 cups of water should suffice for short bouts of exercise, and that's about half hour, 45-minute bouts of exercise. And this is because our bodies tend to sweat more when we're exercising, and you just basically need to replace those fluids when that happens. An average person can lose 25 to 45 ounces of fluid during about an hour of exercise. So kind of a good way to determine how much you need to kind of replenish when you exercise is weigh yourself before you exercise and then weigh yourself after. And for every pound, you need to replace about 16 ounces of water. So it's a good kind of, which is about 2 cups. So it's a good kind of guesstimate when you are working out how much you need specifically to replace. If you are exercising and your exercise is more intense, meaning you're training for something or you're exercising more than an hour, it's best to use a sports drink that contains sodium in it, as this will help replace the sodium lost when you do sweat. Sports drinks are only necessary really when you are extreme exercising or training. Otherwise, water can definitely properly hydrate you for normal exercise sessions that are less than that time frame. Other factors that can play a big role are your environment and your climate. If you live in a hot or humid environment, you can oftentimes sweat more, in which requires additional intake. Otherwise, if you live in a cold climate where you're indoors in heated air, this can cause your skin to lose moisture as well, so something to consider for the winter time. And if you're in cold, dry air, it can cause skin to lose moisture as well. So there's various types of climates that can impact your fluid intake, so something to keep in mind. Also, another factor, other factors are illness and health conditions. If you have a fever, if you're vomiting, or if you have diarrhea, or if your body loses additional fluids, these are cases where you should just really focus on drinking more water. In some cases, your doctor may recommend some oral rehydration solutions such as a sports drink or electrolyte replacement drink. Something to consult with your doctor when you do have those illnesses. Other illnesses that may need to focus on increased fluid intake are bladder infections or urinary tract stones, so something to keep in mind too when you have that happen to you. All right, perfect. All right, continuing on, looks like we had some issues with some people not seeing my screen. So if anybody else has any issues with that, just let me know or shoot me a message in the questions box. But we'll continue on. All right, so as we think about rehydrating or tips to keep hydrated, you know, if water or drinking liquids is not something you're necessarily used to, it definitely takes practice to kind of get into a good habit. So here are some ideas to help you transition to drinking more. An idea would be to have a reusable water bottle or like a tumbler mug available to you. Have it at your workstation or at your desk or even in your car. Maybe just setting some daily goals for yourself, saying, okay, I'm going to drink 4 water bottles before I leave the office today, or I'm going to drink, you know, 2 cups before my lunch hour, or something like that. So you can kind of set those mini goals for yourself to keep you accountable. Other ways to keep accountable would be to have somebody that you work with that's also interested in hydrating more, on hydrating partners, so to speak, right? That's always a good way to keep yourself motivated. Set reminders on your phone or your computer, maybe throughout the day. Drink your water, or remember, don't forget to drink your water. And then the last idea would be to once again consume more water when you're exercising. So making sure you get that extra intake in when you are exercising is a good way to get more hydration throughout your day. And obviously water is by far the best option for hydration, but there's other beverages that are considered to be a positive effect of your hydration intake. Water that is flavored or carbonated would be a good way to hydrate as well. Milk is a good hydrator, and it doesn't necessarily matter which percentage of fat. So if you have whole milk or 2% or 1% or skim, they all have the same hydration content. It's just the amount of fat that, if you're conscious of that, would be different. 100% juice is a good way. This also contains electrolytes, so something to consider if you are experiencing signs of dehydration. And then, as we mentioned, sports drinks that contain electrolyte and sodium. Also, other ways to get hydrated are different fruits and vegetables, such as watermelon, strawberries, cantaloupe, grapefruit, cucumbers, vegetables, spinach, sweet peppers, broccoli, and celery are all contain high amounts of water. Some of them contain up to about 90% of water. So if you're able to contain those throughout your day, that also helps with your hydration levels. And then other foods beyond that would be yogurt and soup that can help with that as well. All right, so kind of on the flip side of that, some beverages that can kind of derail your hydration efforts and really kind of add to you know, those dehydrating effects are caffeinated beverages like soda, coffee, and tea. those energy drinks that I have pictured on the screen, alcoholic beverages, all really impact any efforts that you are making towards hydrating throughout the day. So it's something to be cognizant of. Caffeine is a mild diuretic, and this can have varying effects on different people. Typically, significant amounts of caffeine can cause dehydration, so something to keep in mind. It's good to consume about no more than 400 milligrams of caffeine daily. So to give you a better idea, a soda has about 50 to 60 milligrams. Coffee has about 90 to 100 milligrams of caffeine, and energy drinks have upward of 110 to 120. So staying underneath that 400 milligram threshold is a really safe place to be for hydration efforts. Some significant or important signs to keep in mind for dehydration are, especially in our hot summers with the hot sun, is the first and foremost is thirst. Although this is kind of a tricky one because sometimes this can be a poor indicator for people who don't regularly drink water, but obviously that is the first sign to a mild or moderate symptom of dehydration. Other signs would be dry or sticky mouth. You may get an onset of a headache, sleepiness or grogginess, constipation, lightheaded or feeling dizzy, and also feeling of hunger can be a mild or moderate symptom of dehydration. Also, something to consider is severe symptoms of dehydration. Be especially mindful of these symptoms. This would be going to the bathroom less. When you do go to the bathroom, your urine is dark. You don't feel like you're sweating when you should be in a hot climate or exercising. You can feel your heart rate increase or have a rapid heartbeat. And then if you kind of pull out your skin, it has a lack of turgor. So it's kind of that sign that your skin's not bouncing back and there's not enough moisture and hydration in it. So once again, just some signs. Okay, am I accurately hydrated? Am I doing a good thing? You should rarely feel thirsty. Your urine is colorless or very light yellow. And when you do go to the bathroom, it's about every 2 to 4 hours. And that's a really good indication if you are properly hydrated. Pretty easy, right? Straightforward information. All right, you guys, that is all I have for you. So if you are interested in learning more about hydration, please feel free to reference our InHealth newsletter this month. It goes over a lot of the information I covered today, but it is a good in-depth read on that. And of course, I am always available for coaching sessions. So if you're interested in coaching with me, please feel free to log into your InHealth dashboard to sign up, or if it's easier, feel free to just call me directly and we can get you scheduled for a coaching session. Other than that, our next session for our snack bites will be scheduled a month from today on September 28th at 11:30 a.m. Central Time, and we'll talk a little bit more about healthy snacking. Thanks for being here today, and we will talk to you soon.